All right, Mississauga. We're back here with another exciting episode. I'm learning, I'm growing, and it's always fascinating. And I love it when I can actually meet, people in the area of health, especially right here in the city of Mississauga. Now, technically, it was the sixth biggest city. Now I think it's the seventh or eighth. Brampton just overtook us. But that said, we have guests from all over the world, and today we have locals, and they're definitely making an impact. And today's going to be a very exciting episode. I've been on this journey, as I was just telling the founders of Myofascial Canada, Justin and Nelin, that this fascia system is just an area that most practitioners are getting into, and we're going to learn about what is the fascia system. We're going to get to know the Myofascial Mississauga Release Mississauga Center right here in the city of Mississauga. So before we get started, Justin and Nelin, I just want to welcome you to Mississauga Keeping It Real.
Thank you
Thank
so
you for
much for
having us.
having us.
Mhm.
Yeah, absolutely. Um, the podcast really focuses on the body, mind, and spirit. And it's only years later do we really find out that hey, there's this once upon a time you look at meditation, it was like, what is this meditation thing, right? People just sit and they close their eyes, and supposedly they're supposed to feel calm and do these breathing exercises. Now, years, decades later, you see people everywhere, grasping the art of meditation. There's different forms, and if I can use that as an example, now we get into the body itself. And I've been doing some research on this as well. When surgeons go and cut the skin, they pull away all this, layers and layers, and they get to the root of the problem, whatever it is that they need to fix. But we're missing a few steps in between. And now this word fascia has made a huge, what's the right word, impact with people. And the last little bit, I also have been doing some fascial exercising. So this has taken me. It's got me really excited about this whole arena, and I really want to get into fascial and the impact that it has to the body, mind, the emotional, psychological, because we're one holistic being.
Yes.
Before we get there, I guess I'll just start off with you. Let's go with Justin. Justin, um, how did you get into this arena of taking care of the body? Why this fascial release? Or maybe you can just share a little bit about yourself, and then Nelin, you can as well too.
Of course, yeah. I'm a physiotherapist, and it started as exposure through my final clinical placement of my program, where I really wasn't sure what I was going to do with that career yet. I was a little flustered and overwhelmed by the options, and nothing really quite felt like it fit yet. And you study anatomy, you study physiology, but it's very focused on old science of pulleys and levers, and this attaches to this and yanks that, and they're hard structures, they don't interact with other things. It's very segmented. So I get to this clinical placement at a place that I hadn't planned to go. It wasn't in my top 5 list, but I got it anyway because fate works like that, right? And I'm sitting there with my clinical instructor who's trying to convince me there's no such thing as a knee. And I'm like, what are you talking about, right? And what he was describing, it's technically true, right? The knee is the name we give for a region of the body where two bones interact with each other, and there's muscles that attach on opposite sides of the joint. They don't actually end at the knee. The knee is it's nomenclature. It's a name. It doesn't really mean much, right? So really, what he was describing is that everything's connected, and I'm like, okay, why did I study all that anatomy? What the heck? And we're this intellectual debate ends with, okay, just keep an open mind. We're going to go into some appointments and just, observe, and we'll talk afterwards, right? So we enter a room. There's a patient. He'd had both of his shoulders rotator cuff repairs. His second one didn't go as well. He was having a lot of shoulder mobility issues. He was in a lot of pain. And we enter this room and the lights are kind of dim, which is already a different vibe than most physiotherapy clinics. And there's this kind of gentle, thumpy tribal music going on in the background through the sound system. And he complains about his issue. My clinical instructor gets him on the table. And when something important happens and time does this weird like thing where suddenly a lot of time has passed or no time has passed, but yeah. So before I know it, this guy is on the table. His legs are up in the air. He's pivoting off his shoulders and neck, and he's grunting and sweating and groaning and making all these noises. My clinical instructor, with one hand, is holding his feet up in the air as he's writhing around on the table. And I'm like, what the heck am I seeing? Right. And, again, time does that thing again, and the appointment winds down, and he gets off the table and he's crying. He's so happy. His shoulders are moving perfectly on both sides. He's completely pain free. He's hugging him. And I'm like, I don't know what that just was, but I want more of that. That looks really cool, right? And similar things were happening all week where, someone walked in with two canes and hunched over like a full 45 degrees at the back, walk out holding the canes in one hand like he's, about to go for a hike. And it's like, okay, I don't understand what this is yet, but I need to figure this out because something is happening here that's so important. And that was my first exposure. And then from there, it was just, learning more and more about the techniques, going into training myself and starting to practice regularly with my own clients when I graduated. Yeah.
Mm-hmm.
Wonderful. Thanks for sharing that. And then yourself.
Yeah, well, so we're partners in business and in life. And we actually did our physiotherapy training together. So I was a physiotherapist as well for 15 years. And at the time when Justin was learning all this, of course, as students, he would bring it back to the group and share what he had learned and everything that he'd saw. And I was actually living with a good amount of chronic pain at the young age of 22. I already had a significant amount of pain that was really unexplained. I didn't have any understanding of why it was there. And as a physiotherapy student, I had tried all of the things that, that we were taught, and nothing had really worked. And so I was kind of at a place where I didn't know what to do either, but my intention was never to go into private practice. My goal was always to work in a hospital. And that's what I ended up doing out of school. But in the meantime, Justin started showing me some of these techniques that he learned and practiced. And suddenly I started to feel good in my body again. I actually started to find pain relief through some of the techniques that he was using. And so I was like, this is incredible. I don't know what it is either, but like if it makes you happy, like go do it. And so for a long time, we worked separately. I worked in the hospital and he worked in private practice, trying to find a way to make this type of work in a conventional physiotherapy setting, and was kind of hitting a wall over and over and over again. And then we just sort of hit this inflection point where we'd had our first child together, and I had gone back to work after my maternity leave. And it was really, really, really hard. It was much harder than I expected it would be. I was working in the ER. I was working 12-hour shifts. And I was missing all of the waking hours of our daughter. And Justin had finally started to build this solo practice, and it was really taking off. And so he said, you know what, let's just jump in and do this together. We've always talked about owning a practice together, and you and I both see the value here, and we know that there's a bigger audience we need to serve. So let's just do it. So that's what we did. And in January of 2020, we opened our doors for two and a
During
half.
COVID, like the
Yeah.
beginning. Yeah.
Yeah, we had to shut them 2.5 months later. But it was quite a ride that first year. And we learned so much about each other and about business. And we're still here and we're still standing and things are going great. So that's how we came to be.
It's amazing the fact that you guys had this growth mindset. Like, hey, what is this? It wasn't resistance. It's like, okay, it's more of like a curiosity, right? And most people will put a block up and sort of say, I don't understand it, let it go. But it seemed like you guys sort of welcomed this curiosity. And then through that curiosity, what I'm hearing is that there was this understanding, okay, maybe there is something here. And then you guys sort of opened the door and you sort of welcomed the work that you do. Is this the same time where you start to uh, uh, put learn about more of the fascia? Was it a schooling that you went to? Like how did that come together? I'm assuming that in your story that you're talking about this fascial release.
Mhm.
Is that right, Justin? Is that what
Yes.
you were
Yeah.
talking about? Is it like a certain school that you went to after physiotherapy? Like how did that come to be?
Yeah. So Myofascial release wasn't really taught in our program. We were taught how to mobilize joints and how to stretch and do things to trick the nervous system into moving more effectively. And this was completely different, right? So what ended up happening is I was exposed to John Barnes' myofascial release, and he's just passed back in December of 2025. But he was teaching up into his late 80s. He was an incredible man, but he had this seminar group that would run throughout the U.S. and sometimes in Canada here and there. And I started taking courses, and at this point, I've done all but one or two of them because they aren't directly relevant to the patients I treat. But yeah, his work, he's sort of considered the father of myofascial release. The important thing to recognize is that myofascial release is not a protected term like some other therapies that they've, like a registered trademark. So a lot of people say they do myofascial release, but really what they're doing is some kind of soft tissue mobilization. You're moving the body while the therapist is holding a spot, or it's very aggressive or quick. What John Barnes myofascial release is it's finding the hot, hard, or tender where the body is bracing or holding, and then waiting at that barrier with gentle pressure, compression, or stretch for the system to connect and feel and soften into that restriction. And that physiologically takes at least 5 minutes to really start happening. It is very much an embodied, very purposeful way of connecting that a lot of other therapies don't quite do, right? So there is specific training for it that I took, and that's what the foundation of Myofascial Release Mississauga and Myofascial Canada is.
Yeah, you probably trained for like a decade.
More than that, yeah. I finished my their system MFR3, the expert level training in 2023. Yeah.
So it's not like a quick workshop or something, and then you get a certificate. It seems like there's years of continuous education.
Mm-hmm.
Yeah,
No,
and
it is.
integration, you have to really use it day to day to
Yeah.
see how it works for people.
No, absolutely. So let's. People may be asking, okay, what is fascia? Why don't we start off with that? And yeah, who wants to take that one on?
Yeah, well, I can start.
Yeah, go for it.
So the fascia is a three-dimensional web of connective tissue that is continuous from head to toe in the body. So a lot of people think of it as like the wrapping of muscle and bones and joints, but it's so much more than that. It's not just the wrapping, it is the scaffolding for every single cell in the body. And so it supports not just the muscle and bone, but the nervous system, the blood vessels, the brain, all of the internal organs, literally every single cell in the body. And so, because of the fact that it supports everything, it means that every tissue in the body is connected. So, the tissue of the abdominal wall and all of the muscles is connected to all of the internal organs, which is connected to the spine, et cetera, and so on, right? And so when we see the body in that way, that everything is interconnected, it does change the way that you see how pain patterns work. So interestingly, when we have restriction in the fascia, because it supports all of the structures of the body, if there's restriction in the fascia, it can create crushing pressure on all of those structures that it supports. And when that happens, pain doesn't always follow a typical musculoskeletal pattern, which is essentially what we were taught in physiotherapy school. It can be wildly different and show up in many different ways and with, quote unquote, really weird symptoms. So I'll let you get into how the physiology works.
Mm-hmm. So one last thing just to note with what Nelin was saying, right? We have this idea from our anatomy textbooks that muscle attaches to bone, that ligaments attach between two bones. But really what you have is the muscle becomes tendon, which becomes bone, right? It's a continuum. So there is no separation, right? But you're designed to absorb and distribute force. You walk in gravity all day long, and you are developed in what's called biotensegrity. If you imagine on a macro level, your bones as being the hard struts and the muscle and other tissue as being the soft tissue that holds it. It's like one of those, if you've ever seen little balls like the kids' toys where you can bend them and squeeze them, but they maintain constant volume, right? on a micro level, it's the scaffolding of the cell. It's the microtubules of the cell embedded in the fascial matrix, and the cell walls becoming the soft parts that bend and twist and move, right? So it's that as above, so below kind of thing. But basically, you absorb force and you move through gravity, and life is good until something happens. It might be 8 hours a day, 5 days a week, 52 weeks a year in the same positions all the time, whether you're in good posture or bad posture. Ideally, you're a dynamic creature. You're meant to move, right? It could be emotional stressors, environmental stressors, things like inflammation from diet and gut health and all that. It can be physical stressors, an ache, a pain. You sprain your ankle, you trip and fall, you land on your bum. But ultimately, your body now adapts to try and create safety, right? So let's say my back hurts, I'll sit differently in my chair. Life is good, right? But if I don't do something about why my body felt the need to compensate, I'll continue to do that because that was comfortable that last time. And the other time when I was in the correct position kind of hurt. So I just don't. Subconsciously, I avoid it. And that is problematic for obvious reasons. If you're avoiding certain movements, you start to lose mobility and fluidity in those movements. The ground substance, it's basically the liquidy gel between all the cells in the cell structure. If you imagine it all being in a very wet system, it's like it's a fluid full of proteins and other stuff. It actually glues down. And that dehydration, that gluing down, is what puts the 2,000 pounds per square inch of pressure into the system. So with
Oh,
myofascial release, you aren't technically stretching the fascia. The fascia has an incredible tensile strength of up to 2,000 pounds per square inch. What you're doing is holding at that barrier where things are stuck and waiting for the body physiologically to respond. Right. And in about a minute and a half, the elastic part of the tissue lets go. So you feel better, nerve conduction, blood flow changes. You do a 30-second stretch, you feel good for 30 seconds, right? The issue is, like an elastic band, it bounces back. All right. So you hold it a little longer. Maybe you're in a restorative or yin type yoga class. And if you get to at least 3 minutes, you start to feel some real melting, right? Your body really starts to feel softer. But this is the beginning of the melt. It's like at the end of the party, if you look at a jello mold, it's slimy and yucky, but it's still jello. If you go 5 minutes or longer, that jello melts. It really and truly begins to melt back into a liquid. And with that, lines of tension are restored. There's less pressure. Range of motion improves because the muscles can move and glide more effectively. You pattern more smoothly. Strength improves for the same reason, the patterning, as well as, sending signals to muscles to fire, and they're not busy bracing against imbalance. So you can actually test stronger. And physiologically, your body begins to release its own anti-inflammatories and blood vessel opening chemicals at 5 minutes or longer as well, which create long-term changes in pain gating and your body's ability to connect on a cellular level with what's happening in that area that was restricted. So you start to improve cellular communication and metabolic waste removal and all these things that make your body heal.
wow. Just listening to what you were just saying, Justin, like, the system is set up, right? Like we go to the doctors, what's wrong? And, they're great memorizers and they're like, oh, here, just take this, here's a prescription, go. What I'm hearing you say is that this approach, um, the patient has to be involved in the
Mhm.
work that they're doing to heal themselves. It's not like, okay, I'm going to do everything for you. So the question that I have is, with everything that you said, it affects psychological, there's an old saying, our issues are in our tissues. So things that we hold on to. So as the practitioner, you're supporting the patient in their healing. And if I can say this, please correct me if I'm wrong. It could be one session or it could be multiple sessions until that patient surrenders to what's holding on. If I can say that, does that make sense?
Yeah, absolutely. I think the nature of the technique of myofascial release that we apply, the sustained pressure technique as taught by John Barnes, is that it is done in an environment that helps people bring their walls down, that helps people kind of relax into it at the outset, like Justin was saying, with the dim
Yeah.
lighting and the music. But even just the energy of the practitioner that you're going in to see, you're not going in to see them for a 15-minute appointment. You're not being rushed. It allows the body, like allows the nervous system to downregulate a little bit. So at the outset, there is this gentleness to it that allows people to surrender a little bit. And then the next step would be putting hands on. And it's in that hands on sort of energetic exchange where the two beings involved are asking permission from one another. Not verbally. We do always ask for
Yeah,
permission before we put hands on
that's right.
patients, but also energetically, right? So that we have to apply a gentle pressure that the body isn't going to brace against immediately. So again, another set of walls can come down. But you're right. There is a component where the person on the table needs to be able to drop into their body and allow themselves to feel what's happening in those areas where we're working, to allow for that surrender to happen and for the tissue to melt and get all of those wonderful benefits. Because if they don't feel safe enough, they don't feel enough safety in their body to surrender, then that's where they start hitting roadblocks. But for the most part, I think our patients are really looking for something different when they come to see us. And so for the most part, we get them in that first session to be able to start to surrender.
Yeah, you sort of segue to the next question that I was going to ask. Sometimes people hold on to, like, they're ready to release up here in their head, but the body, there's a book, I forgot the name of the author. The body keeps the score,
Yeah,
Yeah.
right?
Gabor
So the body,
Mate.
sorry.
Gabor Mate, I think his name
Is
is.
it okay? Yeah, I believe so. I believe so. And the body does keep the score, and sometimes the body does not want to release because it's not. It doesn't feel safe. So then, through your technique, how do you make the patient feel comfortable? Because maybe they're ready to change, but the body is still holding on to the wounds or the past emotions. Is there a way to sort of overcome that? Is it just delicate touches? Just that comfort?
Key thing to note is that we can't make anybody feel anything they aren't ready for. So sometimes we're intellectually, yes, I'm ready to go. I put my money down. I'm here. Let's do it.
Yeah,
But that doesn't necessarily mean that you're physically in a space to do the work that needs to be done for yourself, right? So the key is showing up, and the one of the best forms of control is the ability to let go of control,
yeah,
right? So it's come in not with the expectation of you're going to alleviate my pain,
yeah.
because you're focusing on the thing you don't want,
That's right.
right? It's how am I going to look, how am I going to move, how am I going to feel when I have reconnected and feel comfortable in my own skin, when my shoulder is moving well again. What am I doing with it? What does my life look like, right? People get so caught up in the experience of the pain itself that they end up reducing the amount of activity, or they stop doing the things they enjoy and love. And if you imagine your life as being like a big ball, and pain as being a smaller ball within it, as life gets smaller, pain takes up a proportionately greater proportion of your life. Sorry, our dog's
It's
barking in the
all good.
background. Apologies.
It's all good.
Yeah. So the key is, can you envision what life looks like afterwards and really deeply connect with that feeling? And then as you start to connect with the therapist, and they're applying pressure, they're pulling, they're stretching, and we're looking for where the body is stuck. It's can I allow this to happen, even if it is a little bit uncomfortable? It should always feel like a therapeutic, ouch, more please, hurts so good, if it even hurts at all, right? Sometimes it just feels good, but if it doesn't, it's always from that place, right? And then the other piece is, sorry, the dog really distracted me. I got off the topic. Right, so yeah, I'll throw it to Nelin. Sorry, I lost my train of
You
thought.
lost it. Yeah, yeah, yeah.
Yeah. Yeah. Which is to say, yeah, you can't make anybody feel what they're not ready to feel. But if we can help them sort of like emotionally attach to their goal of how they want to feel in their body when they are finally pain free, that can help again to bring them into that more connected place where they are willing to sort of like foray into or explore those feelings.
Yeah, like we lose contact with our body, right? Like people don't live. We live like zombies from the head up, right? It's like, and then years of just this molding, and then call it the matrix, call it whatever you want. We lose contact with the body, and years ago, actually, I didn't know. I was just starting to learn about fascia just a little bit. This was probably about a decade ago. I did some Rolfing, and I don't know if you've heard of Rolfing,
Mhm.
and Doctor Rolf, I believe. I think that
Yes.
was
Yeah,
her name.
Ida.
Yeah.
Ida Rolf, yes, that's right. So she has like a 12-step program. And I didn't know what I was getting into at that time. My work provided me these extended health and wellness, what you call it, extended insurance. And I was like, okay, what am I going to do with this? I go, let's do something different. Instead of just doing like a massage, I go, let me get out of my box. And then I went for 12 weeks, and every week, like a different layer, like fascia and I don't know what's the difference between fascia and myofascia, if you can explain. And then
There
there's
isn't
different
one.
levels. Like there's like four levels. Like there's a superfascial. Like what level do you get into?
Well, the fascia is continuous head to toe. So, really, the labels that you're giving it are just
Yeah.
in order to help people understand it better.
Oh,
So,
okay.
the fascia that you're seeing at the superficial level is at the superficial level, but then it continues deeper. And so, then you're considering that deeper fascia. A lot of people do see fascia in layers in that way. In the John Barnes approach, we don't really see it that
Yeah,
way.
there is no separation. There's no such thing as layers. It's all just the way that we might describe it in a textbook.
Mhm.
Yeah.
Ultimately, any pressure on the body, if it's enough pressure to connect into the system, a little bit of shear force will connect deeply and can connect throughout the whole system, right? Like I've worked on a patient's ankle. They told me they felt it in the other ankle. Nelin had a headache yesterday that she alleviated by working on her quad,
Mhm.
right? So, yeah.
No,
Yeah.
it's amazing. Yeah. Like, what is it not to say, Justin or Nellen? Like, can we do this on our own?
Oh,
Like,
yeah.
didn't we
Definitely.
used to do this once upon a time, at way back, in different parts
Yeah.
of the world, where people would do it themselves, not knowing that they're actually working on their,
Yeah.
myofascia.
You used to do this when you were a kid,
Hmm.
but you forgot, right? Essentially, um, somewhere along the way, our exploration of the world and the joy and fun we experience of rolling around and doing all kinds of weird, goofy stuff
Mm,
and bouncing and shifting and moving, we come headfirst into, hey, there's a curriculum at school you need to learn. Sit down, be a good little boy, girl, put up your hand to ask questions, no more fidgeting and jumping and running around. And we're domesticated
yeah,
into sitting still, right? We're domesticated into focusing on, like you were saying earlier, living from the head up,
yeah,
because the body sensation and body awareness is secondary to your capacity to perform and produce,
Hmm.
right? And the consequence is that we forgot the skill. But if you look in the animal kingdom, basically the only animals that don't regularly self correct through, let's say this morning you woke up, you had a nice big yawn and you stretched a bit. It felt good, right? Why'd you stop? You had things to do. I have to go brush my teeth. I have to get dressed. I have to take the kids to school. Blah, blah, blah. The only animals that don't follow through to the other end of that awesome sensation of stretching and yawning and moving, bouncing, jumping, playing are adult humans, domesticated animals, right?
Yeah, I mean that's so true. Like, so your body has this self-corrective power, and yeah, unknowingly, a lot of people have been doing it for years. We're still doing it today, even as adults. Like Justin was saying, in that short little period of time we give ourselves in the morning, where we allow that spontaneous movement and yawning and whatever the body needs to occur, but then we cut it off really quite quickly. And so there's three pieces to the John Barnes myofascial approach, but one of the big ones is what's called unwinding. And that's that subconscious movement, that self corrective movement that we don't allow ourselves to have. But if we just gave ourselves permission or learned that that was okay to do, it is one of the most powerful self-corrective things that we can do, where you don't need any knowledge of anatomy or physiology. You don't need to know what the name is of the muscle that you might be working in. You don't even have to follow a specific musculoskeletal pattern. You literally just do what feels good and let your body move. Um, in any position. You can do it lying down, you can do it sitting, you can do it standing. In standing, a lot of people do this without realizing, just by dancing.
Mhm.
Right. And just letting their body move how it feels like it wants to move, like that idea of dancing like nobody's watching. That also is a little bit of myofascial unwinding. So you're right. People have been doing it for years, but to Justin's point, we've been intentionally taking that away from our day to day life.
Yeah. No, absolutely. You can see, like, kids are absolutely free during nutrition breaks, recess. They're just running around. They're just being themselves. They're living in the moment. And then, like you had said, Justin, we sort of become domesticated. We could become like good students. We become stationary. And then our sort of, not only our body, but our creativity, our holistic being, where the base was once upon a time vast, is sort of, you know, starts to narrow down, and we sort of become stationary almost. And then we have these midlife crises and issues and problems. And we're like, what's going on? All these years went by, and we lost that disconnection. And I love what you guys sort of reminded us, the importance of just play. And Nellen, you had mentioned just like, dancing, just like, no, like if no one's watching you. So those little movements do support any type of. So this is just, so I guess this also helps with the lymphatic system, like I guess the whole body, doesn't it? Right? Like
The whole
Yeah.
body.
clearing and the just toxins and whatever we hold on to, from emotions to psychological. Like Justin, you had mentioned, I think earlier, that in your training, somebody had a breakdown, or with the clinical director, you had mentioned, and when he was raising his feet, he was, hugging. So people have all these releases, don't they?
Mhm.
Yeah, it shows up in different ways too. And because it's all connected, there's a lot of research now finally to show and support that when there's dysregulation of the fascial system, there will be dysregulation of any of the systems it touches. So the lymphatic system, the blood vessels, the nervous system, all of the things that make us, one big functioning human,
Mhm.
they can be changed at a micro level. And then, like you were saying, in midlife, that's when these things start to really creep up on us, because our bodies were so good at compensating for it for so long until it kind of hits a breaking point. And so that tends to be when people come to see us, usually in the 30s or into the 40s, when we start to notice these things becoming more than just a one-off. They start to become persistent and difficult and irritating and affecting our lives. And so it's not just a part of aging, although age does happen to happen at the same time. It's because our bodies are compensating for so long until they just can't anymore, and that usually tends to happen in the 30s and the 40s. That's when we see people start needing a little bit of guidance.
Yeah, do not buy into the idea that it's because of your age, because you are giving your power away completely to something you have no control over. The only difference between you now and you 5 years ago, 10 years ago, is that you have that many more years of the same imbalances and patterns persisting, either in thinking, feeling, and movement, that are continuing to crush and restrict and strain.
It makes sense. Absolutely. Absolutely. I totally agree with you, Justin. Um, what is the connection with myofascia and sports? Athletes, is this something that, I don't know if you have colleagues, associates who work in this world of sports high at the highest level, where they are now implementing a myofascia techniques? Because usually, like you look, for example, we're here in Ontario. You look at the Raptors and the Leafs. They're not doing so well right now, but they have a whole sports team. From usually it's like massage therapists and physiotherapists. Is there like an influx or open mindset that, hey, maybe fascia release could also work? Do you have any insight into that, or
I have some
connection?
colleagues who work with professional athletes. Most of them are in the US. There's, by population, just more athletes, right?
Yeah,
Football and hockey and,
yeah.
whatever, right? But it seems to still be like certain people recognize it made a big difference for them, and they'll, recommend a
Mm.
myofascial release therapist, but it's not commonplace where there's an MFR therapist on the team staff or anything yet. I imagine it may eventually go there, but athletic performance, you're trying to eke out quarters of a second, halves of a second, or you're trying to eke out, a few extra miles per hour on a fastball or whatever. There's a strength component but you can't strengthen your way out of an imbalance. Once the strengthening program ends, you'll get pulled back into the same strain patterns. A great example would be groin strain injuries in hockey players,
Mm.
right? Happens off.
Oh,
Sorry, happens. We lost connection there. Sorry.
we're back. Yeah.
Yeah, sorry. We're talking about hockey players,
Yes.
and
That groin.
groin strains happen often, and it's the consequence of getting smacked into the boards and then trying to skate, which is a really adductor inner leg muscle heavy activity on an unstable pelvis from having just gotten jammed into the boards, right? So if you deal with the imbalance in the system and you maintain a mechanically stable pelvis, and that will improve nervous system communication, which will improve athletic performance for the strengthening and the other things you're doing anyway. It adds to athletic performance for sure.
Yeah, I wish you know these. If we could rewrite the school system, there's so many different programs that can be brought into high school. Like myofascia. I remember taking this specialist course in physical education, and the importance of stretching. Right, like you want to stretch before any exercise, and then I do a little do a warm up, and then do it to cool down as well too. But bringing in all these different, um, approaches, it's not open yet. Like it's still new, isn't it? Right? People are still learning all this stuff, and I wish it could speed up a little bit more. But I guess it's like you can't rush these things when it's meant to explode. And people, and you guys are here with me, and we're sort of sharing this here in the city of Mississauga and around. I wish it could go a little bit faster, where these services are more available. We're still stuck in this,
Yeah.
like traditional approaches, and
Yeah, so do we. Listen, we wish it too. We really do. But you know what it is? Like this idea of compartmentalizing things,
yeah,
compartmentalizing our own bodies is so prevalent, and it's really hard to break those patterns. But I will say, if there is a professional team that finally realizes the value of bringing on an MFR therapist instead of just an athletic trainer, just a strength trainer, just a physiotherapist, and all of those things, they'll be the ones with the edge.
Mhm.
They'll be the ones to take it to the championship, right? So,
Yeah, Jays, if you're listening, right?
yeah, we can do it this year. But Justin's worked with some professional athletes in the past. He recently was working with a power lifter,
Mhm.
and it gave her that slight edge, and she's been a champion multiple times.
she's not from the Hawkstone in Mississauga, is she?
I can't confirm or deny
Oh,
anything.
okay.
Patient confidentiality.
Yes.
Yeah.
Yeah. If you go on our Instagram though, she's openly shared that she's worked with us, so you can go and
Oh
check
no,
her
that's
out.
amazing. Yeah, absolutely. And you know what? And it's not only for athletes, right? Justin, right?
No,
It's for
absolutely. It's for everyone.
everyone, right? The average person. Not everybody's going to be an athlete, right? It could
Mm-mm.
just be for the average person as well, who's just, from the recurrence of doing the same patterning in their job, they get sort of stuck.
Hmm.
And coming to see you, you sort of open those channels, really, just to
Yeah.
make them feel more relaxed in their body.
Yeah, it's for the grandma who maybe martyred themselves for their kids' needs so
Yeah.
much that when their grandkids came around, they realized they couldn't easily get down to the floor anymore. It's for the young parent who is struggling to find ways to connect with their own body after having given birth or not getting back into an exercise routine. It's for the athletes who hurt themselves too. It's for anybody who feels like they're wearing a shirt that's on 2 sizes too small because their body feels stuck, right? Like that's what we do.
Yeah. How does what's surprised you, right? Like since 2020, you guys opening up your clinic right here in Mississauga, and your continuous learning about myofascia. Has anything surprised you with this art form, and how impactful it really is? Stories, anything that comes up?
I mean, we have so many stories.
Mm.
It's always a delight more than surprise because we know what this work is capable of. But like I can give you an example of we had a patient who was diagnosed with myofascial pain syndrome, very young, and just wouldn't accept the diagnosis, and power to them for believing that. They found us, and within a short series of treatments, they essentially went back to their doctor, and the diagnosis was reversed because they didn't really meet the criteria for having that syndrome anymore. We've had patients who have come in with frozen shoulder,
Mm.
diagnosed with frozen shoulder, that we could resolve in one session. And I'm not saying that's typical, but it's happened before. People with acute low back pain who have resolved in one session, because sometimes it's just that one little missing piece that
Mhm.
people haven't quite caught on to. I mean, that's not necessarily typical that it'll just take one session, because those people were already ready to really like drop in and feel into what was going on in their bodies. But I mean, we've seen some pretty incredible incredible things. Yeah.
Mm. I had a client who, when I first met them, they couldn't look me in the eye because their head was flexed forward and to the side because they had had their gallbladder removed twice.
Oh,
And yes, twice. You only have one.
I know.
They didn't do it right the first time. So a year and a half later or whatever, after still being in tons of pain, they re-imaged and found it and said, oops, and they removed it again. But now he had so much scar tissue in his abdomen that it was affecting his neck and shoulder and mobility, right? So he had gone and spent like 10,000 US on this fancy week-long training program in the US that was supposed to help with his scar work. And when it wasn't going the way that they had advertised it would, they gaslit him into saying, well, it's you, it's you're too big, you're too that, whatever. And I saw him, and in 4 sessions he was looking at me straight in the eye. His neck mobility had improved considerably. He had more hope than he had had in years. That kind of result is very, very common
Yeah.
when you trust yourself to take you where you need to go with a little bit of help and support.
Yeah, he's one of our biggest cheerleaders now.
Oh, it's amazing. Yeah, it's amazing. Earlier, I had mentioned to you when I did Rolfing through the Ida Rolf. There's her one of her main principles, or I don't know if that's the right word, was the impact that gravity has on us over time. Does a John? Sorry, is it John Barnes you had
Yeah.
mentioned?
Yes.
Do they also include that the effect of gravity, and sometimes we start to shut down? Is there a component in that as well?
I mean, gravity is
Ubiquitous.
omnipresent,
Yeah.
right? It's going to be there anyway, but the emphasis in John's work is on the internal architecture, the biotensegrity. It's what is the body doing about gravity? Because gravity is just there. It's
Yes.
it's like energy in general. It's not good or bad. It's how we label it, right? Gravity can be bad if, because of the way you're bracing in your body to adapt to gravity, it's now dysfunctional and creating pain,
Mhm.
right? So it's a little bit less on the gravitational
Yeah.
pressures. It's about what is the body doing. Because another thing that can happen is if you only ever treat a patient laying down on a table, as soon as they get up in the gravitational field, what you've done can shift and no longer be as supportive and as comfortable or whatever, because maybe you weren't treating in the position that they were going to be spending most of their time in, sitting or standing, right? So we do treat not just on the table, but in sitting, in standing, kind of like we were talking about with self-care, for that purpose, right?
Yeah, because I mean, if you ignore the gravitational component, you're going to end up not where you wanted to be. So you do need to acknowledge it from an assessment standpoint, like assessing where things are in gravity and standing, also what they look like and how the body adapts differently when it's not under the influence that's highly of gravity, when it's laying down on a table. But then treating in those different positions as well gives you that added benefit of being able to help the body adapt and be more resilient in different positions.
No, absolutely. It makes total sense. There's, the world is going through lots of shifts and changes. People say it's a spiritual fight, good versus evil, and the apocalypse. Like, we've hit bottom rock, and now, the strong and conscious will arise. And I think this is also having an effect in the health and wellness area, where people are sort of like, okay, you know what? I'm not feeling good. let's get the support that we need. And so, you get a lot of different somatic modalities. In the body centric, it could be anything from a simple massage. I don't know if you've heard of Bowman therapy. I see these wonderful couple in Wellness Roots in Milton, and they're chiropractors, but they don't pop bones, but they just do a little bit of tapping, and it's just great. I see it everywhere, and I think for you guys to create a comfort zone where people can come in, it allows them to sort of surrender and relax, and then you guys being the hold, making sure that you give them that space. Yeah, you guys provide that space. It's amazing. We need more of that. We definitely
Mhm.
need more of that.
Yeah, there's a lot of prevalence in the rehab world of treating the body like a machine.
Yeah.
And a lot of rehab is focused on that. And unfortunately, that will only take you so far, truthfully. It is so useful in the world of, elite performance in athletics. But for the regular person,
Yes.
not as much. Like, it can really only take you so far if you're not connecting into your body. And that's the part that you're looking to heal. You're going to end up looking for the next thing and the next thing and the next
Exactly.
thing and the next thing when the answer was in here all along, you know?
Absolutely.
Mhm.
So in the last about 10-15 minutes that we have, how does what is the start when a patient comes and sees you? Like, how does that whole process work? From the initial phone call or a quick text, what are the steps that take place after that? Whoever wants to take
Yes.
that one on.
Yeah, sure. So, when a patient makes initial contact with us, either via email, phone, or a text, we like to get a really good understanding of where they're coming from first, right? Like, what are the things that they're experiencing, and what are the things that they've already tried, and what has worked and what hasn't worked. And most of the time, the story is quite long. a lot of the patients
Imagine.
that Yeah, a lot of
Mhm.
the patients that come to see us have tried so many things. They have been on that path of looking for that next thing that gets them that really whole, full well being of their body instead of just the piecemeal bits of well being. And so we help them to understand first and foremost like why the journey has kind of happened the way it has happened. When we're missing that fascial piece,
Mm,
this is how you can end up kind of only getting little bits. And then we help them understand and integrate how the fascia like functions in the body and then what they can expect with us. And
this
then
is
when they
all
have
in the
that.
first like consultation, sort of, Nelin. Is that
Yes,
what it is?
that's right.
Mhm.
Yeah.
Yes. So it's either done on the phone or if they're already ready and they already have a really good idea, then they'll come in and we'll give them a little bit more of that deeper understanding in conversation in that first appointment. But putting our hands on the patient is really the thing that helps them to understand even more deeply.
Mm,
Yeah, it's a conversation, I both verbally as well as with your body, where it's one thing to, like we talked about, intellectualize and understand it. It's another to feel it, right? So we try to, wherever possible, communicate where certain things may be connecting to the big picture, what they're feeling, but more importantly, always is what that client, that patient is experiencing as the connection between those things, right? So when we're putting our hands on someone, we're pulling, we're pushing, we're stretching through a region. What does this feel like? What does it remind you of as you develop that connection of that familiarity, or you start to piece together, oh, this is quite tender based on what you're describing. This would likely be an indicator that your body is bracing like that, right? And then it helps to put the pieces together so that when someone goes home with a few stretches and activities to do, some basic postural stabilization movements to do, they understand how it's going to help them, what they can expect to feel when they're doing their own self care, and ultimately where they're going with it so that they have a really good reason to do their homework.
absolutely. And going back to what we were saying before, right? The patient now sort of take governance and making sure that they are involved in their healing. And so after the first, second treatments, is that when you sort of say, okay, we think that maybe another 4 sessions, or is there like a protocol that you guys do, or is it just whatever the patient, like you had mentioned, Ellen, like there's frozen shoulder within one session. Some patients can get healed. So is it you sort of making that choice or seeing where the body's at and through touch and feel?
It's a little bit of both, right? Like we want to make sure that we're addressing the patient's goals.
Yeah.
And so if the goal was to just, alleviate the pain in the shoulder and that happened in one session, then that's great.
Yeah.
But we also want to make sure that the patient understands how they got to that point in the first place. And then if they would like additional support preventing that from happening
Yeah.
again, we probably would do more than one session. Um, but yeah, I mean, typically we do see 4 to 6 sessions is what it takes somebody to reach the goal that they came in with. But it can vary. Some people get to that sooner and can take on that responsibility of self care for themselves much quicker. And some people have so much more complication in terms of their life, but also what they're feeling in their body, and need a little bit more support ongoing. So it depends. We don't love the idea of protocols because um, people are so unique. You can't really put them into a box like you can with like a very specific injury. Let's say, like I used to work in the hospital and I would see patients who had total hip or total knee replacements, and there was a very clear protocol to get them to the goal of being able to walk again, right?
Right.
But when we're talking about holistic body healing, I mean, there's so much there, right?
Mhm.
So we let the patient and their body kind of lead the way, but we give them our guidance.
Yeah. Generally, most people's goals, if they've really thought about what they want and they set a high bar for themselves, require them to be strong doing certain things, whether it's hiking or biking or playing or whatever, right? And in order to be strong, you need to have the stability to hold yourself there. And in order to be consistently stable, you need to restore the fluid motion, right? So, what we do recommend is planning to come in for 4 to 6 sessions, because some independent research that was done does seem to indicate that the majority of people feel a significant shift and change that is positive in their body, even if they haven't quite met that long-term goal yet. They certainly feel like they're well on their way, right? And we sort of divide it up. We're focusing on your mobility. Great. It's starting to improve. We're adding postural stabilization while continuing to maintain the mobility. Great. You're starting to do more. Let's get you challenging the activities that you really want and see how your body responds to that. So it's all about checking on and feeding back with the resilience that that person is experiencing for the things they want to do.
Do just to ask you another question, Justin. Do people also come and just say it may not even be a pain, but more of like an emotional, like, hey, like I'm experiencing a lot of emotion in my body, and I don't know how to deal with it. Have you? Is there a connection to that as well too? Like people come in, it's just not pain, but it's emotional pain. Like
Yep, sometimes. As a physiotherapist, I treat movement, right? So what I would do with that is, ask someone to describe where in their body they feel that sensation,
mm,
right? If you're describing an emotion, I feel anxious,
yeah,
right? Anxious has a blueprint. Okay, well, what does anxious feel like? Oh, my chest feels fluttery. I notice my breathing change. Okay, let's assess your body position. This is just an example,
yeah,
right? But you notice a ton of tension in their jaw, a lot of restriction in their breathing patterns and their motion. I'm focusing on helping that person connect to the physiology that their body is expressing as a consequence of the thing that they came in to shift.
yeah.
Right.
No, that makes sense. What is the connection to breathing? Because
Oh, everything.
Yeah.
Yeah, you do it all the time.
we wouldn't
So
be here right
unfortunately,
now. Yeah.
yeah,
Uh,
exactly, exactly.
so even through like these fascial releases, are people, the patients, like we hold so much in our breath, right? And sometimes past the trauma, we lock in. So through the fascial release, our clients, patients, like breathing out the tension.
Often getting off the table, people are describing and noticing feeling taller, breathing more smoothly, more deeply.
Mm,
They feel calm, right? It's a natural consequence, because as you pull into that system, you're going to be affecting vagus nerve. You're going to be affecting the depth and quality of rib cage expansion,
mm,
right? But without, I could dive down for like 10, 15 more minutes on
yeah,
just the breathing piece, right? But a common pattern, the skull has this natural flexion and expansion and extension compression it naturally goes through. It's this little kind of a pumping
Oh,
motion, and it does that along with the pelvis. So there's this kind of shift through what's called the dural tube, the connective tissue that ensheaths the brain and spinal cord. And it's part of normal hormonal balance. It's part of normal cellular metabolic activity to clear waste from brain activity, right? So this is where a lot of that like brain fog stuff comes in. It's restriction that's affecting cranial motion. But the point ultimately is, as that system begins to move better, the entire body benefits. The nervous system mobility improves the muscle activation and the performance. It improves the breathing. Interestingly, poor breathing mechanics, because of sitting and slouching and your head forward in space, you think of your traditional, like using a phone or iPad kind of forward, that kind of thing. It mimics the same kind of position that having tight tongue and oral tissues do to retracting the jaw and creating tons of tension in the throat, right? So poor breathing mechanics, mouth breathing, those sorts of things can create nervous system mobility issues and cranial and pelvic mobility issues, and vice versa.
yeah. Yeah, and I love this holistic approach to the body, mind, and spirit. And I think we're living in a time where people are definitely taking those opportunities to get out of their comfort zone and really find out what's out there where they can sort of bring this healing. And then I guess many still need to be reassured that it's them who's in this process. Nobody can do it, like you said, Nelin, right? Like nobody can do it for you. We can provide you the space, but you have to
Mhm.
surrender and sort of heal and go through the process. Um, in the last couple of minutes that we have left here, where are you guys located in Mississauga? Like whereabouts, and how can people reach out to you? I'll definitely add your website on the show notes. But those who are listening or watching, how do they reach to you? Reach out to you guys, and where are you guys located?
Yeah, thank you. So we are in beautiful Streetsville in Mississauga.
Oh, whereabouts?
So yeah, we are actually right next to the Streetsville GO station. So right on Thomas Street. We are in this beautiful building that we share with Kerhulis Dental and Avix Hair Salon, and we are on the third floor of the building. We have the whole floor to ourselves, and some beautiful space where we have private treatment rooms. And if you're in Streetsville and you know what it's like to be in Streetsville, we also have free parking that's on site, which is great, and elevator access. So, yeah, we've been in Streetsville since 2020. We're actually also residents of Streetsville. We love it here. Everything here is beautifully walkable, and it's a great environment to raise our kids as well. And so, if anybody wants to come and see us, you can find us on Thomas Street. You can contact us by finding us on the web if you just type in Myofascial Release Mississauga. You can also find us on all of the social media channels at Myofascial Mississauga or at Myofascial Canada, if that's easier for you to spell. And we're always welcome to anybody who wants to come in and get connected with their body, ask questions. We're always happy to answer them. Reach out to us by email, schedule a discovery call. There's never any pressure. You're ready when you're ready. But we would love to help you understand your body better.
That's amazing. Yeah, no, definitely. If you want to, get some healing and try this body healing and be the power that we are, allow yourself to sort of give permission to start that process, I would definitely recommend coming here. Um, Justin and Nelin, is there a question that I did not ask you that you were like, I wished Banu had asked us? Because, I just want to make sure if there's anything else that you guys want to say in the last couple of minutes. And yeah.
I don't know. I think you did a really good job of asking questions. I would just say that like the world of fascia is really expanding,
It
and
is.
there's so many different approaches out there. We're never going to say that one is better than the other, but in any way that you can use that as sort of like a gateway to connect better with yourself as the underpinning for any kind of healing work or any kind of fascial work whatsoever, that should really always be the goal, in my opinion, because that's where real healing tends to happen.
Mm-hmm. And hijacking your question and making it our own, golden nugget moment. The key to feeling is healing. right? And truthfully, the healing journey isn't the most important journey. It's really the only journey. It's about connecting and coming home to yourself. Yeah.
Beautifully said. Like I don't even know what to say after that, Justin. It's true. Absolutely. Coming home. We're coming home right in Mississauga, right in Streetsville. It's a beautiful place. Amazing couple, making a difference, making an impact, allowing people to move forward in their lives. So thank you, Nelin and Justin, for coming on. And I wish you all the best.
Thank you
Thank you.
so
You as
much.
well.
You as well.